Greetings and welcome to week 2. This week we're going to talk about HIPAA and how it affects ICD-9, ICD-10. First question we might ask is, what is HIPAA? Well, in 1996, the Health Insurance Portability and Accountability Act, or what we now call HIPAA, was endorsed by the United States Congress. The HIPAA privacy rule, also called the Standards for Privacy of Individually Identifiable Health Information, provided the first nationally recognizable regulations for the use or disclosure of individuals' health information. Essentially, the privacy rule defines how covered entities use individually identifiable health information, or what we call PHI, personal health information. Covered entities is a term that's often used in HIPAA compliant guidelines. And a covered entity can be healthcare plan, healthcare clearinghouse, healthcare provider. And just to give you a little overview of the rule, it gives patients control over the use of their health information. It defines boundaries for the use and disclosure of health records by covered entities. It establishes national level standards that healthcare providers must comply with. It helps to limit the use of PHI, or personal health information, and minimizes chances of its inappropriate disclosure. Strictly investigates compliance-related issues and holds violators accountable with civil or criminal penalties for violating the privacy of any individual's PHI. It also supports the disclosing of PHI without individual consent for individual healthcare needs, public benefit, and national interests. And usually within, like, let's say we're within a hospital, the only ones that should have connection or have access to a person's medical histories or personal information are the ones that need to, and that would be the medical team. That would be the doctor, the nurse, the radiologist, the surgeon, whoever's working with that patient, the insurance company, like those. Now, HIPAA realizes that there's a critical need to balance the steps taken for the protection of a person's individual health information, along with provision of proper healthcare facilities. The privacy rule strives very hard to regulate the sharing of PHI without making it a deterrent or assessing healthcare facilities. The privacy rule does not permit disclosures under special circumstances wherein individual authorization is not needed by public healthcare authorities. It does permit disclosure. And those are cases that you have to, like if a doctor has to call in a surgeon for his patient, he would have to disclose something with that. Now, how does it affect ICD-9 guidelines? Well, the key takeaway is that ICD-9 CM guidelines have been issued to bring about standardization and uniformity in the use of medical codes. so making them standard and uniform across the board. Adherence to this guideline is a requirement under HIPAA. And if you'll remember, HIPAA stands for Health Insurance Portability and Accountability Act. The International Classification of Diseases, 9th revision, clinical modification, or more properly known as ICD-9-CM, is a set of guidelines issued by 2 departments within the Department of Health and Human Services, or DHHS, the Centers for Medicare and Medicaid Services, or what we call CMS, and the National Center for Health Statistics, NCHS. These ICD-9-CM guidelines provide healthcare professionals with the knowledge of how to code and report diseases, and this has to be in accordance with this instrument, ICD-9. They're also meant for accompanying and supplementing the extant official conventions and instructions that the ICD-9C has already provided for you. Okay, some facts about the ICD-9-CM guidelines. They're to be used by healthcare coders when allocating the ICD-9-CM diagnosis and procedure codes. You're required to adhere to these under HIPAA, these guidelines. These, however, are guidelines and hence are subservient to the more clear-cut conventions and instructions that classification has. Although the ICD-9-CM guidelines provide additional instructions on how to code and sequence diseases as set out in volumes 1, 2, and 3 of ICD-9-CM. These are the guiding documents. ICD-9-CM guidelines have full details of how medical coders have to go about general inpatient coding. These are some of the general areas that have to be adhered to. Use of both alphabetic index and tabular list, level of specificity in coding, the use of not elsewhere classified or NEC or not otherwise specified NOS code titles, conditions that are classified as being both acute and chronic, codes relating to combinations, the tabular list, multiple coding of diagnoses, late effect, meaning residual effect or a condition that's produced, ICD-9 guidelines when diagnosis is unnecessary, and the guidelines on impending or threatened condition. Transactions and code sets that are affected. On August 17, 2000, the HIPAA transactions and code set regulation was published in the Federal Register. It was entitled Health Insurance Reform. We've heard a lot about that, haven't we? Standards for electronic transactions. Announcement of designated standard maintenance organizations, final rule and notice. Big, long title. And really what this rule implemented was some of the requirements of the administrative simplification subtitle of HIPAA, or the HIPAA Act of 1996. While still under 2000 regulation, excuse me, my tongue's getting tied. I'm saying more words than I need to. While the year 2000 regulation pertained to standardizing and requiring electronic billing transfer of information such as claims, referrals, eligibility requests, remittance, advice, etc., as well as the utilization of particular code sets used in those transactions. The 2004 National Provider Identifier regulation pertained to standardizing provider identifiers, and the 2005 proposed claims attachment regulation pertains to standardizing and automating the process of attaching additional claim information to the electronic claim. The government also wanted to give us tools to enhance these requirements, and thus the 2003 rule gave us the proposed enforcement regulation. Now, as far as HIPAA, let's talk about the claims attachments. 2005, September 23rd, the proposed rule adopting standards for electronic healthcare claims attachment was published. And the healthcare claims attachments are those documents that and information required by health plans to adjudicate certain claims. The proposed rule mandated that the HIPAA Act of 1996 adopts two new X12 transaction standards: an HL7 messaging standard to carry clinical information in the response transaction, and the HL7 specifications for the content or questions that may be asked in each of the 6 attachment types. This proposed rule also adopted the logical observation identifiers, names, and codes, or LOINC, as a new HIPAA code set to be used to identify the questions and answers, or the attached information. The standards allowed for the transmission of structured or coded data, as well as images and text. The proposed rule solicits comments from the affected industries on several key issues, including the adoption of LOINC, LOINC, and the use for HIPAA transactions, the appropriateness of the 6 proposed attached types, business requirements for attachments that would accompany the original claim. These are considered unsolicited attachments, and the cost-benefit implications of adapting this transaction set. The HIPAA codes for ICD-9 of course, we have in ICD-9, what we have clinical, it's clinical modification, volumes 1 and 2, including the official ICD-9 CM guidelines for coding and reporting, as it was updated and distributed by HHS. And they did this for the following conditions. They did it for diseases. They did it for injuries, impairments, other health-related problems and their manifestations, um, causes of injury, disease, impairment, or other health-related problems. So in that last one, they just added everything together, basically. Um, as it was updated and distributed by HHS, they moved to Volume 3 procedures. And as it was updated and distributed by HHS, so for the following procedures or other actions taken for diseases, injuries, and impairments on hospital inpatient reported and reported by the hospital. So that covered prevention, diagnosis, treatment, and management. So even though we all think of HIPAA as being a bane or a pain in the butt, because you have to really watch yourself as to what you're saying, what you're doing, how you do it. There are some good things that came out of it, with the coding. I mean, sort of upgraded. We almost, at one point, did not adapt or adopt ICD-9 International. And now we're about ready to move into 2017. There's another upgrade coming. So, we need to be up on all of this. So as a coder, medical coder, you really need to every day check and make sure that nothing has changed. Because a lot of times, I know from experience, having worked in dental office, and when I would send claims electronically to the provider or the clearinghouse, a lot of times by the time they got that, the code that I sent had changed, and they would shoot that back to me and tell me I had to change the code. So it's very important that we pay attention to what we're doing and take our time. And I hope this has given you a little insight into the HIPAA aspect. And I look forward to reading your comments for your discussion questions. Thank you for your time and have a great week. Happy learning.